I'm Rick Buck and I've been a dentist for 15 years. In this video, you're about to see how and why I extract this tooth and also how I replace it with a dental bridge, including all the steps I take and why each step is important. So like and subscribe if you have teeth. This patient came in 6 years ago with this broken tooth because they didn't get a crown on a back tooth with a root canal, and you need to put a crown on a back tooth, otherwise this will happen. Now, this is an x-ray of the tooth, and this shadow around the tip of the tooth is a huge infection. So because of that, now the tooth needs to come out. Okay, so now the patient is numb, and once they're numb, we want to test it out by pressing on the gums. When I do, you can actually see some of the pus from the infection expressing or oozing out, and you'll see that from time to time as a dentist. So now that we know they're numb, then we move on with the same instrument and we pull the gums away from the tooth. Then once the gums are unattached from the tooth, we're ready to move on to the tooth extraction. In this case, we're just going to grab the tooth with the forceps and put pressure back and forth until the tooth loosens and breaks free. This tooth is badly infected, so it is coming out and it's moving really easily, and you can see how much the tooth is moving here. And so once again, we just loosen and loosen until the tooth eventually comes out. Now, with the tooth out, you will notice a few things right off the bat. First, that loose, gross-looking tissue connected to the tooth is infected granulation tissue. That is what filled the dark spot you saw on the x-ray. It doesn't always come out like this with the extraction, but it's kind of cool when it does, in my dentist opinion. Second, you can see the chunk of tooth missing from the tooth, and that is how low the fracture was 6 years ago. And as a side note, that is why you need a crown after a root canal. Otherwise, it almost always breaks like this. So now with the tooth out, we irrigate the socket with ozonated water, as it will help kill any possible infection that may be left behind. Though with the tooth out, your body will do that anyway. Now you can see in my mirror kind of what the socket looks like, though I have other videos where you can see this a little bit better. So now let's move on to preparing the teeth for a bridge right after the extraction. And to be clear, preparing the teeth for a bridge happens at the same appointment as the extraction most of the time. To prepare the teeth for a bridge, we file down the teeth adjacent to the socket 1.5 millimeters in every direction all the way around the tooth. The reason we have to file the tooth down is that you can't just put something that covers over the tooth. It would look bulky, and when you bit down, you would only bite on the bridge and none of the other teeth. So we are filing it down, and this negative space that we're creating will all eventually be covered and filled in by a bridge. Now, there are a lot of technicalities and things that I'm doing as I'm drilling. First, I'm doing a few things to avoid tooth sensitivity. Anytime you have a tooth drilled on, it is possible for the tooth to become sensitive. But because of my techniques that I'm using, this rarely happens to my patients. First, I don't drill deep into the tooth. The further you drill into the tooth, the more likely it becomes sensitive. So if you happen to be a dentist watching this, my margins aren't going to be as deep. Now, the second thing I do to reduce sensitivity is I use tons of water. You see, the drill we use heats up the tooth, and the water keeps it cool. The more water I use, the cooler I can get the tooth to stay. If the tooth heats up too much, it can start the inflammation process in the tooth, and that will cause sensitivity and pulpitis, which can eventually possibly kill the tooth. And if the tooth dies, infection can get up into the tooth. One of the difficult things about bridges is making sure that there are no undercuts anywhere when you're drilling on the tooth. The circumference of the tooth left behind, that you might call a stump and what us dentists call a prep, have to be less than parallel with each other. So the perimeter wall of the stump converges at a 5 to 10% degree angle. That way, a bridge will slide over the teeth without getting stuck. If the walls diverge or are parallel, the bridge won't fit or get stuck before it's supposed to be attached permanently. Then there's another problem. If the walls converge at more than 10 degrees, you may have issues with the bridge coming loose from time to time from a lack of retention. This might make more sense in a minute when you see how the bridge slides over the teeth. Once I confirm with my mirror that a bridge can slide onto this prep, I also check the patient biting down that there's enough space between the teeth to put a bridge thick enough that won't break. And I know this because we want at least 2 millimeters of space between the prep and the opposing tooth it bites against when biting down. These 2 millimeters will ensure that the final bridge will be thick enough to fit a bridge that won't break in time. Now, all of this is done for a permanent bridge, but during this appointment, the patient is going to get a temporary bridge, not the permanent one yet, and that will happen at an appointment that I will show you in just a minute. Quickly, my favorite toothbrush, floss, and other dental products by far are in Amazon affiliate links in the description below this video. Those dental products will give you stunning results every time you clean your mouth. And you can also watch my video posted at the end of this video to see why they are the best and how to brush and floss your teeth with immaculate results. To make a temporary bridge, we need to fill that socket with a membrane so the material for the temporary bridge doesn't get into the socket. To make it temporary, we fill an impression that we took before extracting the tooth and filing the others down. And we fill those 3 template teeth that we're using for the bridge with this viscous temporary material. Now, it's flowing at first, but that material will harden in a minute or two, but not before we place the impression in the mouth, where it will form a temporary bridge over the 3 prepped teeth and filling in all the negative space of the filed down tooth. Now that will make sense in a second when you see it. So when we pull out the impression, in this case, the bridge comes out with it. So now we have the temporary bridge roughly formed in the impression, and we have to take that bridge out of the impression and start to remove all the excess material off of the bridge. Before you see the final result of this temporary bridge, and as I'm trimming it up, it will not be as cosmetic as the final bridge. And you can see that the temporary looks all right in the mouth, though the gums are quite beaten up from the procedure. This is common if the dentist had to drill below the gum level to get to good solid tooth, and the gums will heal in a few days. So now we fill up the internal of the temporary bridge with temporary cement, and we set it and push it down into place. The extra adhesive will flow out from the temporary bridge, and we remove the excess cement before the patient leaves the practice. So this temporary bridge has to last us about 2 to 3 months, and there's a reason for that I'll go over in just a minute. But let's fast forward to the next appointment 2 months later, where we take the final impression of the prepped teeth. Normally at this appointment, I like to numb the patient because we will be moving the gums out of the way to get a nice final impression. You see, gums are very aggressive at growing back. So sometimes they grow back too far over the tooth for this procedure. So now I want to show you why we wait 2 months. Before we take it out, can you see the space between the temporary bridge and the gums on the middle tooth of the temporary bridge? Well, if this were the final bridge that we made right after we extracted that tooth, this is what would happen after a couple months of being in that permanent bridge. You would have a permanent space between that tooth and your gums because the gums didn't have a chance to heal yet. You see that space? It doesn't look good, and it gets food caught under it all the time if this happens. But now moving on, we remove the temporary bridge, and now this is what it looks like underneath. Everything has healed up nicely, and this is now ready for the final bridge. So I quickly refine the margins of the bridge preps at this time. Margins are the tooth ledge left behind where the tooth will transition to the bridge or crown. These margins need to be sealed completely, or decay can easily get under the bridge margins. Because this margin is so vulnerable to future decay, this makes them the most important part of the final impression. And it also happens to be the most difficult part of the impression to get detailed. And that's why those overhanging gums are such a problem. If they're left that way, it will be very difficult to capture that margin nicely. But then again, as a side note, if there's bleeding, it also won't pick up those details nicely. And so there's a trade-off here. So this liquid that we're putting on right now is called Viscostat and stops bleeding pretty well, as you can see. So now we've removed the excess gums and stopped the bleeding. Now we take the impression in 2 steps. First, we take an impression with a quick setting hard material called Blue Bite. So then we remove that impression when it is firm and hard. And so we take that impression that we just took and add a more detailed impression material layer and snap it back into place in the mouth, and that will capture the details of the teeth. Now you probably notice we take lots of impressions and they're all needed and they all do different little things. This method of taking impressions pushes that lighter material below the gum level to get an extremely accurate impression. After that is done, we are retaking the shade of the tooth. So now we send this all off to the dental lab, and they will take the impression and they will make a model of the teeth and build a bridge around the teeth with the shade that we take here. Then after they're done doing that, after a week or two, we will get the bridge back. And so I'm gonna fast forward to the final appointment now, where we try on the final and permanent fixed bridge. Here we slip on and off the bridge and we check 5 criteria for an acceptable bridge before we permanently put it on. We also will be making adjustments as necessary so the bridge will pass all 5 of those points. First, we check how well the natural adjacent teeth contact the teeth of the bridge. If the floss snaps through those nicely, it will also likely prevent food from getting trapped between the teeth when chewing. If that contact is too tight, then the bridge maybe won't sit down all the way and will be very difficult to floss. Second, we check the internal portion of the abutment bridge teeth and under the bridge where the middle tooth sits on the gums. If there is something high or internally off with this part of the bridge will rock and loosen in time. So you want to make sure there's nothing internally off about the bridge. Third, we check the margins where the tooth and the bridge meet. The bridge needs to be flush at the margin and not catch my Explorer. If the margin is open, the lab will need to remake the bridge. Once again, this is the weak point of the bridge, and it's so important because the decay process will start here if it doesn't. Fourth, we check the bite with carbon paper. If the bite is off, the patient will feel it and normally show up as a prominent blue mark on the bridge. It is important to file down these prominent blue spots to ensure an even bite. Actually, it's very common for the bite to be adjusted at this appointment. So if the dentist starts adjusting the bridge during your appointment, it's actually a good thing so that you bite evenly. If the bite hits the bridge before the natural teeth, then the abutment tooth under the bridge can become sore over time, and it can also cause jaw problems as well. Fifth, we check the cosmetics of the bridge. Our patient is very happy with the cosmetics of the bridge, and since she is happy with the way it looks and also the other 4 criteria are acceptable, we then dry the tooth. And then we put permanent cement on the interior of the bridge like we did with the temporary bridge, and then we push it into place and have the patient bite it down securely into place. As the excess cement comes out, we use an Explorer and floss to kind of clean all of that excess cement away. But we do that after the bridge is firmly set into place. So this here is the final bridge. If you're another dentist watching this video, my brother is the lab technician that made this bridge. He is amazing, and his lab info is in the description below this video if you're a dentist. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.